The United Nations estimates that half of the hospital beds in developing countries are filled with people suffering from sanitation-related diseases. So far, diarrhea alone kills more children under 5 than a combination of deaths caused by HIV/AIDS, tuberculosis, and malaria.
Yeah, this is Ziblim Salamatu. She was brought in here because of typhoid fever and a complication of it leading to perforation of the small intestine. There were multiple holes on the intestines. We had to cut and join. We typically refer to that as typhoid perforation. It's an infection that is associated with poor sanitation and poor drinking water. If hand washing practices are poor, or if the environment as a whole is not well cleaned, the bacterium can be transmitted from person to person, either by hand contacts or it can stick on flies who would transmit it onto our food. Somewhere from January to March, we have a peak number of these cases coming in. And that is the time when we have the driest season in this part of the country. When that happens, the few water bodies that we have collected get dried up, and those that are left undried are so dirty, and humans have to share it with other livestock. Even in Gushegu Township, where we rely on boreholes, the water table falls, and then our water supply is no longer adequate enough. So at that time, hand washing, even bathing becomes issues, and then we do see quite a number of these cases coming to us.
Ghana is in a sanitation crisis. Many suffer the consequences of the prevalence of poor sanitation conditions in most parts of Ghana. This situation is attributable to the inadequacy of public access to safe water, good sanitation, and hygiene. About 10 million Ghanaians lack access to safe water. 86% of the people do not have access to basic toilets. Over 3,000 children under 5 years die annually from sanitation-related diseases, particularly diarrhea in Ghana.
It's a crisis when we look at the fact that we have more children under 5 dying from diarrhea, which is a sanitation-related issue. You know, poor sanitation and poor hygiene conditions. So it's a crisis. If we lose one life because somebody doesn't have access to water, sanitation, and hygiene, as far as we're concerned, it's a crisis situation.
To improve the sanitation situations in communities, WaterAid Ghana, a non-governmental organization, is embarking on a sanitation and hygiene advocacy program to draw attention to the deplorable condition in 8 communities from 2 districts, Ekriapim North in the eastern region and Gushegu in the northern region. The situation in these communities is a reflection of the wider sanitation crisis in Ghana.
Sanitation for a long while has been a private affair. Ghanaians don't really want to talk about toilets. It has been very common to see political figures go and cut sword for water facilities, how many water points they have established in this district compared to the other districts, but talks about how many households a district has helped to get access to latrines have not been the best.
Campaigning for sanitation reflects the current country strategy and direction of WaterAid Ghana. It is also a reflection of the poor sanitation situation in Ghana and what WaterAid and the partners can do to promote sanitation in Ghana. In this project, WaterAid Ghana, working with ACDEP New Energy, seek to promote behavior change around sanitation and hygiene issues, to seek assistance, whether within their communities, by their kids and kin, or get assistance from the district assemblies like Akwapim Municipal Assembly or Mushoku District Assembly, or even embark on fundraising and get their kids and kin who reside in the big cities of Ghana and elsewhere to come and help them to construct latrines, so that when they use the latrines, they can improve their health status.
The purpose of this sanitation advocacy program is to bring about change so that at the national level, greater allocation of resources goes to the improvement of water, sanitation and hygiene services and facilities, and greater accountability and transparency from government to the people. The same commitment is expected at the district level.
Nationally, sanitation coverage is very low, and so it goes down to the local communities also. Most communities that we are working in, a lot of them do not have household latrines. Most of them are using communal latrines, and it's difficult to manage communal latrines. The perception is that building household latrines is expensive, but we've been able to get some communities to achieve 100% coverage, through building their own latrines. And one example of such community is Ochikro. A bigger community like Latte, it's not going to be easy, but we think once government is able to get his support for the community themselves will be able to know how they will resolve their problems.
Yawo how krum ha kakra yen toilet ewo ready ha esi ya che 1967-68 near esi toilet no ma yen ya manage toilet na isan say yan ji muskenti yan na ye hweso yan na ye hu bibia up to date ama ene nyoma ya jinsem kakra
eso no kura etu chensen no asaya ma eyi afiso na ayesin nsu to na se ye ba so kura nsu hweye efe ade no ye ba ye bo amanjuma ye nyina ye ba emberima no de impempro na ehyem wo twitwa mpempro atente no wode hyem no wode toilet no se wo hwa ebe ma ye yare pa
se yenyamwa kura na se individual betumi aye bi ewo mu fie afie mu a nka betumi ama ha no nso abafom ama oha na ede mwa ne yare eba no because edu ba bi a ede korora ne your friends yare bebre ba
emri bi mmerima bi ekire won nti wo the force ne se toilet ne kan anu abaso obi won so na so ye den onko hospital ntam nti obekọ toilet ne saa nti ni yonko bekoto so pe no no so anya eye saa mani kum nipa be ye minsa ewa nti toilet ne ha ye mpa nti ye hia moa.
When you consider Latte, one, they do not have continuous supply of water. They don't have pipe-borne water, but they have streams which flows continuously throughout the year. And so there is the need to have a complete engineering of the whole processes, combining water and sanitation, to be able to get them a system that will be sustainable and manageable.
So your friend Brunkumi, and Chroma time 1958, and Ancrophobi be organizing swing. You have a pipe a tomb. I have far from Fi Kubase. Ama obia a surprise crony na 10 beer 24/7 in so way. Juma say nya mwa etwekọ kroma ebetumi aboa yen na obia ebetumi meka se betumi surprise ekuapem nyina.
In communities like Tinkong and Kwamoso in the Akuapem North District of the Eastern Region of Ghana, the situation is dire. The lack of access to potable water and improved latrines compounded by an acute waste disposal problem, is making life unbearable for most residents.
Your problem will come has say a fat your toilet. May your bad time. You share near me costona. Toilet in Ukromuha. To be who no be a toilet, see her, no be a toilet, see my area back.
Once people do not have places of convenience, you know, they tend to move around and get things done. It's creating a whole health hazard.
We've written letters to the council. They've done nothing about it. They said it's owned by the government, so unless the government authorizes them to come and collapse it down before they can do it, or unless we come and buy it, then we can collapse it. And it's worrying us so much here. When it's in the afternoon, we cannot eat. The scent coming out from that place is very hectic. And even you cannot eat outside because of the housefly coming from that place. And the kids too, because it is full, they don't get inside the toilet. They come outside to comfort themselves outside, and it is affecting us so much here.
Yemboleng, Adibia, a high and Pabri, a Mac Romana, a Bolan, a Ben woman, Omubrepa, Insua, a Tokrana, and Namni baby, Bolana Bessiquino, a Zuna Adrama, Tuntum, Nadia, Adobe Bray, into Chroma for no demonstration, the Abamiho, Amamika say crown, went to train the other Sequino, so Muma assembly no in fact on Bola Midu. Me as assemblyman, I say Minimajuma, until me get Miss Aban say, Aban can and if you want a 9-4.
You were running here, Mimi. Yeah, con. And you know when you're bang, you're calling your joker set you. Chupani, I hear and say still living you in a con. No, you are even up here.
Am I own children? Oh, fear my to me, my head. Yarina, I have sent me to me best, so I feel so. No best so school united. We send me best comment to me pretty beam. I'm going to come back and contribute. It's a mamma's me, it's socially do so. Mammy to me, there's a time
The situation is so alarming that even the community-based health planning services CHIPS compound has not been spared.
Clinic now what chronim. Yes, a man, you might any year mind be rich. Be 2 years, me, a boy who I used to say, in terms of any community members, pray or more dear no. You say Nankasa and so Nipane Okronim. You say the idea of Kakoto. In the way to meet them better hours, fancy in your one boo. Baby, ye, you know, Hanusi. I will be behind say on the bound yes, Shimalaya Nadia. Yent me, so I'm not concerning a money drew. Or by a penny, the donor man, so coffee on cotton. They don't see any young qua. Sakala, yes, and or by a bonnet. Yes, a man who coffee on Waka, you will feel. A beer so clinic by a bear 5 years me. Ye need a janine biaha. Obi ba kwa mpo no ya na so obi ditene ne kaka mpo a wonya baby obey ni mu ye Jesus asan ko fie na wa na
The northern region equally faces severe sanitation problems. The situation in Wantugu, Zamashegu, Zantile, and Dandaboli are all very dire.
Anapa mi sori ameba pipe mu ha miti anye ye kura ameba no ensuene na asa mi nya bi mu aya ho nkyire de mame ye kwa pipe bi be yem wa mal enti be ba no na tama dile untimi nkwa afum nkwa ye wo ho adwuma bi enti nka ye pa ma atwa pa asanka district assembly eni NDOs ye pa ma atwa pa nkwa mo boy ni nsuo na nka ye pe
yo na dam lo shi dam la bangira ma sonne tutun morna tutun tor mo te tumban wona te kasabta to bangi te dangu chef kan to ko dangu la bangira ma sonne morna yong ni se samba na gulu nyanse la kata ko dangu
It is obvious that there is lack of real leadership committed to ensuring the delivery of water, sanitation and hygiene services, and ongoing failure to recognize the fundamental importance of WASH to wider development and prioritizing WASH.
It's not only the health sector, the education sector, the agriculture and livelihood sector that WASH has impact, but many other sectors, including the energy sector, the environmental areas where we also are making contributions. So we think that with our work we have been tilting the scales. We have been addressing some of the persistent inequality and poverty in Ghana by helping to provide clean water, safe sanitation and hygiene services.
Without any initiatives to mobilize communities to take the needed action to construct basic household toilets and maintain public latrines, open defecation will continue. New Energy, a WaterAid Ghana implementing partner in the northern region, is vigorously working with the people in these communities to reduce open defecation.
Currently, we've been in Bushewood district for the past 16 or 17 years, and we've entered over 200 communities in the provision of water and sanitation facilities in those communities. As part of provision the hardware like the latrines, the water facilities, we also do what we call the school health programs, that is SHEP, where we facilitate schools to form what we call the SHEP clubs. And these SHEP clubs, they are sensitized, their capacities are built in sanitation and hygiene promotion activities. Most of the schools that we provided the hardware facilities like the school latrines, institutional latrines, water facilities like rain harvesting tanks. We expect that the school, the children in particular, are able to manage these facilities, sustain them, and then improve their hygiene practices in the school. For instance, we believe that when they are healthy in school, they can continue to sustain their learning. Their attendance will be improved and their academic standards will also be improved.
When the children come to school, they have to go to the borehole site, fetch water and clean the toilet. And we have only 2 boreholes in this community. One is in town, one is a little bit outskirts. So what they do is that when they go to that, they have to queue because there is a pressure there. They have to queue and before they can get water. Sometimes we have to go and appeal to the community members, the women there, so that they give them chance to fetch. And sometimes we can't just do otherwise. What we do is that they have to go that far away, fetch. And you know, with that, it is affecting our academic work because they normally exhaust classes hours searching for water instead of be in the class learning.
WaterAid is joining communities to demand for an increase in investment towards the improvement of sanitation. And we're also asking that these funds are judiciously used. They must be spent in a manner that is accountable and transparent. We're also requesting that the communities be involved in decision-making concerning the use of the funds that are meant for improvement in sanitation.
Imagine if attitudinal change also happened at the top, and key duty bearers and district officials like DCEs, planning officers and budget officers prioritize sanitation in their budgets and spend the money as planned, addressing first the most marginalized. This will lead to the elimination of open defecation and improve hygiene practices. The result is healthier communities.
Government must do its role, bring the financing, bring the people with the right skills and capacity to address the issue.
Systematically or gradually, every year we increase our funding to sanitation. At least 35% of my total budget, one way or the other, under education, under health, under sanitation itself, it is all directly or indirectly linked to sanitation. So as a municipal assembly, the Krapim North has increased its funding towards sanitation. We hope to do more.
Luckily, the picture is not all gloomy. The people of Ochikrom in the Kwapim North District have resolved to ensure that their environment remains clean and healthy.
With Ochikrom in particular, they have water problem. So because of that, added with some international NGOs and with WaterAid came to their aid, gave them water facility, as you can see over there. And then we gave them a rain harvest tool, as you can see there. Apart from the water we gave to them, when we came to the community, in fact, their sanitation wasn't that best to talk about. So I decided in particular to organize the women's group to educate them how they can keep the environment. They actually accepted it and they came together as a group. So because of what they have done, communities from the nearby communities have at least seen the good things that Abigail is doing. And actually what they are also doing, we are also promoting them to the various communities in the Kwapim North District to help promote sanitation in communities. So that is basically what Abigail Group in Ochikrom are doing.
Abigail.
However, water remains a challenge in this community, forcing community members to trek long distances in search of water.
Your pipe will crew, and so to there be a pipe, no, not say. I say, a harmony about so you soon your friend is harmful.
WaterAid, Abdep, and Isicom. I do my mind, a boy, but see, I need him one in your account. So I say, soon and swing cry a fat tank we say no, and a rain harvest. It is soon to ya, ye be. And I will so Cacrabia, not say. In Tianca, almost 2 big can home, a baboy, Emma, Yanya, Sa, I want tear, any signing dianoso, Yanya. And if I we money direct in Inti, and Mat near our Reno, and Sucrono cry. Could you believe he said 30 minutes now when you're 34 back? It is the whole day, no. Household we are no obian to me enya nsuo no it is an come to be kan ho man a ana so be ye mechanics and so we no e kan ho man a can feel a bit my boy.
Achieving a cleaner and healthier environment requires concerted efforts from all. It will take the commitment of central government to increase more funds towards the wash sector, especially for sanitation and hygiene promotion. It will take district assemblies to be deliberate in increasing allocations and expenditure on sanitation and hygiene promotion. It is important that district assemblies facilitate the active participation of communities in defining and implementing development goals.
What we are experiencing today is that with concerted effort from all partners, NGOs, the district assembly, the other government agencies. In fact, we are trying as much as possible, even though there are a lot of challenges in the community. But at the moment, for us in New Energy, we are seeing a lot of changes in the community. And we think this effort should be continued.
We are expecting that the duty bearers, that's the Kwapim North Municipal Assembly, will provide their part of the commitment in the partnership arrangement.
Yeah, I want to assure the people of the districts, Oshigo district, and particularly the 4 communities that we have just visited, that in the near future, that is within the next 3 years span, the sanitation situation will be improved. That is why they have people, able bodies like the New Energy, WaterAid, and then Integrate coming into those communities to do this advocacy for us to solve the problem. And so with what we are going to gather, at least whatever we have seen, we'll make sure that it is tackled within the next few days.
WaterAid remains committed to ensuring that every community gets access to potable water and dignified sanitation.
We hear stories direct from communities about how having access to water, sanitation, and hygiene transform their lives, transform their communities. People are able to engage in economic productive activities. They are able to take care of this basic need, which allows them to think about other higher level, needs and aspirations that they may have in life. Their health, they're healthier, their environments are cleaner, so these are some of the benefits.
If Ghana is to reach its developmental goals, then such deplorable sanitation conditions must become a thing of the past.
Right now, the budget for WASH is about 90% or so funded by external donors. The government's portion itself is not what it needs to be, and it's not what has been promised.
At the third high-level meeting on water and sanitation for all, held in Washington in the United States of America, the government of Ghana pledged to invest $120 million per annum in the water subsector and cover 1.14 million users annually. To invest $50 million to sanitation and hygiene subsectors to accelerate sanitation delivery. To commit an additional $20 million seed money to the Strategic Environmental Sanitation Investment Plan, SESIP, and work with the private sector, youth, sanitation entrepreneurs to accelerate household sanitation delivery in the next 2 years.
Also, the National Sanitation Policy 2010, there are a series of well-intended statements in those policies. Communities will be asking questions. How far has government implemented those commitments? So overall, this program is intended to build the capacity of communities to engage, to have decent sanitation facilities, and also call government to action to ensure that they implement their own policies and commitments.
Reliable access to potable water is necessary for improved sanitation and hygiene practices. And this is WaterAid Ghana's call to ensure that all have access to basic toilets and all practice good hygiene. This means giving marginalized communities an opportunity to live more dignified lives. Water is life. Sanitation is dignity. Hygiene improves health.